I have a gum disease and I've had it for about 10 years, but the last 3 years it's gotten really bad. Whenever I look in the mirror, I see an old woman. I see somebody who isn't pretty. I saw on the doctor's website that you can surprise somebody. So I wrote in to surprise my husband, who has been deployed in Kuwait. He is supposed to be coming back next year. My husband's gone. He's been gone half of our marriage. He's always tells me I'm beautiful, but I want to actually feel beautiful for him again.
When we heard Lorie's story, we put together a master plan for the ultimate makeover.
Today's the big day. All of our planning is coming down to one single surgery where the implants will be placed and she will leave with teeth smiling. Dr. Letelier is getting the bone cleared out, making sure that there's no infection, and he's holding the tissue back, making room for us to get ready for a prosthesis and to remove the teeth. So see how it's flattening out that ridge, getting everything nice and straight. That will make it easier for him to place the implant. That's the actual implant itself, going through all the pilot holes and the prep spots. So he's actually screwing the implant in right now.
Here we have all the implants placed. So we have these back ones that go onto the cheekbones on both sides, and then 4 more implants in the front. But unfortunately, the bone was very soft and we did not get the torque that we need in order to place the bridge right away. So we're going to cover the implants, close the gum over it, and then she'll wear a denture for a few months. These are the implants in place in the lower jaw. We removed the teeth, we cleaned out all the infection, we reshaped the bone, and now we have the implants ready for Dr. Willardsen to do the bridge.
All right, so the teeth are ready, and this is going to be Lorie's final smile. That's what it all comes down to.
We didn't get to just transform Lorie's smile. We also sent her to the Sally Hirschberger salon for a total hair makeover with celebrity stylist Paul Norton. Who here is ready to see Lorie's incredible transformation? I know I am. Lorie, come on out and join us. I know you've seen the smile, but you haven't seen yourself today.
No, I haven't seen myself in 2 days.
So smile at that camera right there.
Okay.
And then look up at that screen.
You know, I think so often we still think about periodontal disease and teeth as a cosmetic issue, but as you said in the tape, it affected your diet, it affected your health.
Yes.
It affects the facial structure. And, I mean, you must feel like you have a completely second lease on life now.
I do.
And periodontal disease is more common than people realize. Joining us now is the cosmetic dentist who transformed Lorie's smile, Dr. Joe Willardsen. And clearly this was a big time procedure. But again, once it's gotten to that point, you needed to do that to transform her smile and get her to a point where she can be pain-free, eat, etc.
Yeah, it was a very complex case. As you saw in the surgery, there wasn't a lot of bone for us to work with. Had Lorie let her condition go much longer, we probably wouldn't have been able to do the procedures that we were able to do. It took a team of about 20 people working on this consistently to get Lorie to where she's at. With the procedures and techniques that we used, something that would have taken us a year or 2 years to do, we're actually able to get done in a very short period of time using the new implants and techniques.
Well, shout out to you and the entire...
Oh, amazing.